here.
So for people who just want to be covered against catastrophic illness and don't want to pay for other people's hair transplants or sex changes, they're out of luck. So what are the political elements here? I mean, I keep hearing Democrats saying implementation of Obamacare at the end of the year is going to be a disaster. I can't even use the profanity. It's going to be a disaster.
The chairman of the Finance Committee, Democrat Max Baucus, said this is a train wreck coming. This is the first light that we're seeing at the tunnel heading right at us. They're backing off. If they can blink once, I think they'll blink twice. I think there's more things that are going to be suspended. Last week, last week Gallup announced that they surveyed small businesses around the country. 1 out of 5 said we have cut back on hiring because of Obamacare. Another 40% said we have suspended new hiring. So this is a jobs disaster. We're already seeing a small economic recovery. Obamacare could literally put a blanket over that. In order to avoid losses in the 2014 election, I think the next thing they may delay is the individual mandate.
Well, it's sort of hard to argue that businesses ought to get a pass on the mandate, but individuals shouldn't, no, Doctor?
Of course it has to be consistent. But the problem is that the mandate is pretty much unenforceable. And, of course, there's also the amount of money it's going to cost.
The individual mandate is unenforceable?
Both are, well, John was saying, both are unenforceable. To start with the business mandate, this is going to cost them $5 billion, which they're counting on. I mean, what Obamacare is a big behemoth that has to suck money out of everywhere. Money out of Medicare, which is already, from my point of view as a practicing doc, cut to the bone. I can't even work with Medicare anymore because I'm getting so restricted by regulations. Why do you need those regulations? Because the tests are expensive. Suck money out of Medicare. Suck money out of penalties. Business mandate that they're going to lose now, the $5 billion. Suck money from the individual mandate. Patients are going to have to go to the state exchanges because employers are going to continue to drop them. Without the mandate, even more employees are going to have to go to the state exchanges. Yes, as Joe Trippi said, we're starting the state exchanges this year. Sure, but they're going to be overloaded with employees who are going to be dumped.
You know,
exactly.
This is the easiest way to bring back a cash economy into health care, because a lot of people will drop insurance. A lot of people will be thrown off insurance by their employers. I think you're going to see a black market develop where people will go to the doc and say, look, right up front, I'm only paying cash, so let's negotiate. Because right now, of course,
which would be a far more efficient system,
well, the price
by the
right
way.
now, I mean, there's a guy in California, his hospital bill was $20,000, and he only paid $16 of that. Now, it didn't cost $20,000. He was a lot of cost shifting going around, and he should have paid more than $16. So this actually might create a black market. Unfortunately, that's not the way.
Or maybe a more efficient market. Like, why wouldn't what Expedia and Hotels.com have done for the hospitality and travel industries? Why couldn't?
We're going to have tourism overseas.
Tucker,
for healthcare.
John is making a great point here because there's a great doctor shortage, and doctors can't work with all this insurance. And over 50% of our time is already spent with paperwork. So you know what's going to happen? We're going to say, like we used to in the old days, bring us a chicken. Bring us a gift. Barter us. You know, bring us some money. Cash up front, I'll take cash.
But why not a direct payment?
No, the reason the doctors are going to have to do this is Deloitte Touche just has a survey. 62% of doctors say many of their colleagues are going to retire in the next 3 to 5 years because they can't handle this mess.
This is such a disaster.
That's accurate. That is accurate. Or we'll scale back. The AMA has a survey that shows 17% of physicians are restricting the amount of Medicare we take. We're either going to retire early, restrict our practices, or take cash only.
See, I think in the end, this law will collapse under the weight of its own ludicrousness, its own unworkability. What the Republican Congress has been unable to do, repeal it, maybe it won't be necessary.
And the White House did this only because Democrats in Congress are panicking.
That's exactly
this thing will collapse before the 2014.
Well, look what happened in the last midterm election because of Obamacare. This is an albatross. So far around
what the biggest tragedy here is? It's patient care.
Exactly.
Patients won't get the access.
No,
you're get the access to me and doctors like
me. You're totally right, and that's the thing that we never hear in Washington. Thank you both very much. That was really illuminating. Coming up.